Hi everyone, and welcome back to the Hair Loss Show, episode 62. In today's episode, we're going to carry on with some of the Q&A that you've submitted. So stick around for the next episode of Q&A. Thanks very much.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome back to the Hair Loss Show. Thanks again for watching. If you are really enjoying the content, please remember to like and subscribe to the channel. It helps promote the channel and gets that content out to more people. So today's episode, we're going to carry on with some of the Q&A that we've been dealing with and we've been getting from you. Thanks again for submitting all your questions, and hopefully we'll just work through all these questions and you get some answers for that. So, next question on the list is, hello, at 15 I started losing hair very quickly. In 5 months I went from a full head of hair to having noticeable thinning at the top of the head, but still not alarming. I was diagnosed with Irritable Bowel Syndrome at 14, which caused me to be malnourished and underweight. I'm now 17 years old and still balding. I still have IBS problems. No one in my family tree started balding at 15. I'm the only one. Could hair loss be caused by AGA or an impaired absorption of nutrients? Well, look, I'm really sorry to hear that. That must be very difficult to go through IBS at such a young age and also to experience hair loss. The first thing I'd do is I'd say, look, I think you need to make sure that you get this diagnosed and make sure that this is androgenic alopecia. Sometimes it's not very obvious from a family history or family tree that this is, what's been happening in the family. But I think it's important to get someone to have a look at your scalp, have a look at the hairs, and make sure that the diagnosis of male pattern hair loss, androgenic alopecia, is correct. With the question of how it's related to the IBS and the absorption of nutrients, well, certainly if you are deficient in a variety of different nutrients or elemental nutrients such as zinc, selenium, biotin, vitamin B, etc., then that has been shown to cause hair loss, cause hair shedding, and certainly if you've got IBS, then that will reduce the absorption of not only the nutrients, any medication that you may take. So unfortunately it is what it is, and you've just got to find a way of trying to balance that, how you manage your IBS, what you may potentially have to remove from your diet to stop that irritation and the inflammation that is going on, and then look at ways of administering these as a supplement, and how you can do that to try and best promote absorption, to try and ease the situation. Obviously this individual is 17, so it's very young. It's not beyond the realm of possibility of starting on something like Finasteride. I'm not advocating that in this case. I think again you should take medical advice with regards to that, but just as an example for people out there that may have, maybe further on down the road and certainly have issues with absorption, if you can't absorb something orally, then potentially looking at a topical version, so topical minoxidil or topical Finasteride may be another alternative to take the gut out of the equation, so to speak, and have direct absorption through the scalp. All right, so hopefully that's helpful. Right, the next question. Hope you're well. I had a question for your Q&A. I started taking 0.5 milligram of Finasteride daily around 2 years ago. Within a few weeks, I noticed a few ED symptoms. My erections were softer, more difficult to produce, and far less spontaneous. Additionally, however, I continued with Finasteride for 6 months as I was noticing benefits to my hair. I decided to stop after around 1 year. I think the ED symptoms subsided somewhat when I was off Finasteride for a few months. However, my hair started to shed. Thus, I started taking Finasteride again and have been doing so for the last year. I still have the aforementioned ED symptoms. In your opinion, what should I do? Naturally, I don't want to lose the hair Finasteride has given me, but at the same time, the ED side effects are worrying me. I also do worry about having persistent ED when I decide to stop taking Finasteride for good. Thanks in advance. Okay. Oh, it's a complicated thing. It's a very difficult, scenario to go through. My first and foremost thought on this is, first of all, you need to speak again to your prescribing physician and talk through this issue, because this is something that you need to be guided through. I'm not a big proponent of people sort of saying, look, I'll suffer the side effects at the expense of keeping my hair. I think there has to be a balance point. You really want to try and minimize those side effects as much as possible, and try and tailor make a treatment plan that sort of tries to fit in with the rest of your life. Now, this gentleman specifically is taking a very low dose of Finasteride, 0.5 of a milligram per day. So, that's how effective is that? That's only sort of 3.5 milligrams per week. Potentially taking it daily may be an issue. So maybe reducing the frequency of the Finasteride may be an option. Potentially looking at another form of the Finasteride if you need to be on Finasteride. So using a topical version, or a combination of things where you reduce the dose of the Finasteride even more, but add stimulation therapy as well through either minoxidil or laser or PRP. So it's trying to tailor make. I think the key point here is, please don't just go through life suffering from the side effects and going, look, it's really important that I keep my hair. I get that hair is important, don't get me wrong, but we need to try and find a better solution than, I'm having erectile dysfunction issues, but I want to keep my hair. Try and find a solution, and that's why you need to partner up with someone who can help guide you through this process, where you may need to change the dose of certain things, add other things in that are less likely to cause issues in this department. So hopefully that sort of gives you some food for thought in how this can, how you take this going forward. All right. Good. Okay, next question. Hope you have been well during COVID-19. Good. Okay, let's go. I've been on Finasteride 1 milligram for nearly 4 years, coming to October. I've not had any major bad side effects during that time that you read on the internet. I took it daily for 3 years, 6 months, until I watched your videos. Recommended dose done every 2 days. Good. So he's reduced the dose from a milligram a day to every other day. That's fine. With any of your patients over the years, what's the longest any of them have gone on taking Finasteride without side effects? Do you recommend long-term use of the drug? Yeah, look, I mean, interestingly enough, I actually had a patient that came to see me that had been on Finasteride for 20 years, all right, and had stabilized their hair loss for 20 years and has had no issues with it. And I remember saying, well, look, I think Finasteride has been sort of licensed for hair loss for that period. So he's one of the first people that went on it and has still maintained hair on it. So there are no issues being on Finasteride long term, especially at a low dose. And if you're not experiencing side effects and it's stabilizing your hair loss, then it's doing exactly what you want it to do. Remember, Finasteride is there to try and stop this from getting any worse. It's just trying to stabilize your hair loss. So there's not a particular length of time that I think you should need to be on it and then we should stop. It's however long, A, you want to keep your hair, and B, that it's stabilizing your hair loss for. All right, so next question. How long do you advise your clients to wait before using a machine clipper on newly implanted region after an FUE procedure? And the second part of that question, how do you advise your patients to treat bumps and pimples on the healing of the donor area? How long does it normally take for that region to fully heal? Mine's been 10 weeks since the op and still getting painful bumps and itchy spots. All right, great question. So this is obviously a hair transplant question. Someone's had FUE and is wanting to know, well, how long before I can get a haircut? So basically, after any hair transplant procedure, be it strip or FUE, generally after 10 days, probably less, but I always try and I'm quite conservative. So I say after 10 days, the grafts are solidly in place. All right. By then you should have well and truly brushed off all the scabs from the donor and the recipient area. And so at that point, there's no issues about having a haircut. So with FUE, especially at 10 days, you've sufficiently grown the donor area at the back of the head. And you would have brushed off all the scabs there. So there'll be a good amount of regrowth. You can certainly clip of the hair without any problems and any concerns about damaging the grafts in whatever way, shape or form. So that's the first thing. I know this wasn't part of the question, but if you've had strip, I would probably wait another couple of weeks, not because I'm worried that the clippers or the haircut will damage any particular area. It's just that the suture is still healing, the suture is still in place and the wound is still healing for up to 3 weeks. And sometimes if your hairdresser doesn't know that you've had a procedure done or is not careful, sometimes the clippers can get caught in the suture, and it's unlikely, certainly after 10 days, that you're going to open the wound, but it can cause you to scream out in pain a little bit if the clippers do get caught in that sort of end of suture. So I generally wait a little bit longer if you've had strip, just from a perspective of making it easy. And once that the suture's fallen out and the wound is fully healed, then absolutely no problems whatsoever. To the second part of that question, well, how do you, what about bumps and pimples? Well, that's perfectly normal and classically happens around 6 weeks post-surgery. And what's happening is basically when you're transplanting a new graft, there's an oil gland that goes with it. And that oil gland needs to secrete oil to coat the surface of the hair. But because it's in a new place, it doesn't have a tract for the oil to pass up the shaft of the hair follicle. So during that time, it's trying to find its way to the surface. That classically happens around 6 weeks, 4 to 6 weeks post-operatively. It forms a pimple, so the grafts are not getting infected. You don't need antibiotics. Please don't pick and pop them. It's a one-time pop of that pimple, then that tract is now formed, and it will just carry on secreting oil. So in this scenario, I think you don't need to do anything. It will settle on its own, and classically happens around 4 to 6 weeks after surgery. All right, so hope you found that useful. Thanks again for watching, and we'll see you again on the next episode. Take care.